I think we'll be taking the next question now. The question goes, so my cousin tested positive for hepatitis B during a routine checkup. He feels completely fine. Can this still be dangerous?
Hepatitis B always is a chronic infection. Sometimes it can be an acute infection too. If you have chronic hepatitis B, it is a very serious condition. It needs treatment. We determine whether the presence of this virus in your liver is leading to problems. What problems? If it's causing active inflammation, and then you see that the virus is dividing in your body or replicating. These are the type of patients who actually need our help. So we help them by treating them with antiviral medications. And we keep monitoring them. We keep an eye on how the liver looks, because it's not just the inflammation and the cirrhosis development that is at risk, but also hepatitis B itself can cause liver cancer too. So we have to keep evaluating and checking ultrasounds every 6 months or so. That's what we are recommending in these patients, so that we keep things under control.
And doctor, what does the treatment for hepatitis B and C look like? Are they completely curable?
At this point, hepatitis C, the treatment, we are striving towards complete eradication. Uh, there's been a significant improvement and advancement in the type of viral medications that we have. Previously, we used to treat these conditions, at least hepatitis C, we used to treat for a very long time, for almost 6 months and 9 months when I was in my training. But now it's come down with this new regimen of combination antiviral medications, come down to, you know, for it's come down to 2 weeks, 2 months, 8 weeks, or 12 weeks of treatment, and it's proven to be very effective. So we
Mm-hmm.
do go for complete cure for hepatitis C. For hepatitis B, it varies actually, and that's the nature of the beast. We keep the treatment going till we see uh, signs of complete cure, which is not very common, but it is possible.
And doctor, how would you say that hepatitis is different from other liver diseases?
Hepatitis, it's an acquired infection. You get it from somewhere else. It's not something that you are born with. So awareness is very important. Um, it was the lack of awareness a few decades ago that led to the rapid spread of these conditions. Things like hepatitis C, from drug use, from close contact, from sexual contact. All these things, we are not aware of it at that time. But now, a big part of tackling this problem is to be aware and to prevent them from happening, right? Um, After you get the infection, then the patient has to go through evaluation and get the proper treatment. Whereas other conditions, let's say you are born with inborn error of metabolism, or something genetic like hemochromatosis. These are conditions that you're born with. There's no escape from it. Autoimmune hepatitis. Those things. They just get diagnosed down the road, and there are different treatments for it. So at the end of the day, what we are trying to do with your liver is we try to address the situation, address the problem, treat the problem, so that we prevent it from progressing towards cirrhosis and eventually needing transplant, things like that.